Hello everyone. This presentation is on Si Ni Tang, also called Frigid Extremities Decoction. It appears on the California Acupuncture Board Examination Herbal Formula list. I will review its traditional pattern, a short hypothetical patient case, 3 potential drug-herb interactions, and a practical management plan. The purpose is educational. Herbal formulas are selected by pattern, but medication safety still requires attention to pharmacology, dose, duration, and the individual patient. Traditionally, Si Ni Tang is classified under warm interior cold. A representative pattern is severe yawn collapse with cold extremities, fatigue, diarrhea and a deep faint pulse. Important ingredients include Fu Zai, Gan Jiang, Gan Kao. The key clinical idea is pattern matching. A formula can be appropriate for one patient and inappropriate for another patient with the same biomedical diagnosis. Before treatment, I would also screen for red flags, confirm that urgent biomedical evaluation is not being delayed, and review the exact medication and supplement list. My hypothetical patient is 70-year-old man with coronary disease and arrhythmia history. The current medicines are amiodarone, digoxin, furosemide. This case gives a plausible reason to consider Si Ni Tang, but it also creates interaction questions. I would document the tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about allergies, pregnancy status when relevant, kidney and liver disease, bleeding history, and use of over-the-counter products. Medication reconciliation is essential because many interaction risks come from the combined physiologic effect rather than from one single herb. Interaction 1 is Fu Zai plus antiarrhythmics. The mechanism is aconite alkaloids can trigger dangerous arrhythmias when dosing or processing is inappropriate. The clinical significance is potentially life-threatening. My management plan is avoiding high-risk cardiac patients unless specifically supervised by an experienced clinician. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 2 is Gan Kao plus furosemide/digoxin. The mechanism is licorice can lower potassium. Low potassium increases digoxin toxicity and arrhythmia risk. The clinical significance is high clinical concern. My management plan is monitor potassium and avoid prolonged licorice exposure. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 3 is Gan Jiang plus antiplatelet drugs. The mechanism is ginger family constituents may have antiplatelet effects. The clinical significance is usually low to moderate, depending on dose and co-medications. My management plan is monitor bleeding risk and avoid stacking concentrated ginger products. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements.